A few years ago, a woman came into my office and she just started to cry. Now, normally my clinic is a happy place. We keep it light and fun with my staff, and yet we care deeply about our patients. But this consult was a little different. She'd had a brow lift surgery and a lower eyelid surgery months earlier. The eyebrows were way overcorrected. She couldn't even really fully close her eyes. The lower eyelids had been pulled down and scarred like a hound dog. Even worse, her scars were still visible months later because the surgeon cut way below the eyelashes across the cheek, which is a no-no in my book. And then she said something I've never forgotten. She told me, the night before my surgery, I just had a bad feeling about the surgeon and I was this close to canceling it, but I didn't. Unfortunately, she went ahead anyway. That patient is why I'm making this video, because I want to prevent this from happening to you. I'm going to give you 4 concrete things you can do to avoid getting your eyelid surgery botched. And if you watch to the end, I'm going to give you a bonus tip. 1 question you can ask any surgeon in your consultation that will immediately tell you whether they really know what they're doing. It's simple, it's fast. Most people never think to ask it, so stick around for that. So blepharoplasty, which is the medical term for an eyelid lift, is a plastic surgery procedure that has one of the highest satisfaction ratings among my patients. Most wish they had done it sooner. But the key is that you have to pick the right surgeon, because eyelid surgery has a very low margin for error. The anatomy is unforgiving, and it's measured in millimeters. The difference between a great outcome and a devastating one often comes down to decisions made before the surgery even starts. Here are 4 things that are going to protect you. Number 1, choose the right type of surgeon. This is the most important factor on this entire list, and it's the one most people get wrong. Not out of carelessness, but because the medical system really doesn't make this very easy to understand. Here's a reality. In most places, any licensed physician can legally perform eyelid surgery. A dentist can do eyelid surgery, a family medicine doctor, an ER doctor. The most common specialty that does eyelid surgery are oculoplastic surgeons, which is what my specialty is, in which eyelid surgery makes up the vast majority of my practice. Other common specialties are general plastic surgery and ENT facial plastic surgery. Some do it very well, but eyelid surgery is a subspecialty, and the eyelid is not forgiving of just any old technique. The credential that you are specifically looking for is for an oculofacial plastic surgeon, also called ophthalmic plastic surgeon or oculoplastic surgeon. This is a surgeon who completed eye surgery training for 4 years, meaning they deeply understand the eye itself, not just the skin around it, and then completed a fellowship specifically in plastic surgery of the eyelids for 2 years. Being a member of an exclusive society called the Oculofacial Society is something you can look out for when you're looking for your surgeon. That training pathway exists precisely because the eyelids are functionally critical structures. Now just think about it. The eyelids have to open and close properly. Besides the mouth, the eyelids are the only skin in the body that has to open and close to protect a vital organ. So you gotta be pretty darn sure you put your eyes in the hands of someone who knows all the anatomy. The complications I most commonly see in revision patients are things like lower eyelids pulled down, upper eyelids not closing, significant asymmetry. Those complications are disproportionately the result of surgery performed by someone whose primary training was not in this area. So look for board certification in ophthalmology with an oculoplastic fellowship. That should be your baseline. Tip number 2, know the red flags in your consultation. This is where the patient from my opening story went wrong. She felt something was off, she overrode that gut instinct. So here's a concrete checklist of what a good consultation looks like. A good eyelid consultation involves your surgeon examining your eyelid function, not just the appearance. They should be assessing how well your eyelids close, the position of your eyelid margin, which is the part where the eyelashes come out, and the tone and laxity of your lower eyelids. These are functional things that directly determine what kind of surgery can safely be done. If your surgeon barely meets you, looks at some photos, and moves straight to booking without doing any of this, that's a red flag. A good consultation gives you time to ask questions and gives you real answers. If you ask, what are the risks, and the surgeon says, don't worry about this, I do this all the time, without actually discussing any of the risks, that's also a red flag. If you feel rushed, if your gut is telling you this person isn't really seeing you, listen to that. Good surgeons welcome questions. A surgeon who makes you feel like asking questions is an inconvenience to them is showing you exactly how they will handle a complication if one arises. If you're finding this useful, please hit subscribe. This channel exists specifically to help people navigate eyelid surgery safely, understanding the anatomy, knowing what questions to ask, and finding qualified care. It genuinely helps my channel, and it means that you won't miss the bonus tip at the end. And if you'd like to book a consultation with us, go to eyelid.pro/book, and we'll be able to tell you more about what's going on with your eyelid specifically. Okay, tip number 3. This is a good one. Be extremely cautious about going abroad for surgery. I want to handle this one carefully because I don't want to be totally dismissive. This is happening. There are genuinely world-class surgeons in other countries. I personally know some of them, and they are true superstars who trained rigorously and can get great results. But here's the thing. Surgeons of that caliber tend to charge accordingly. Their prices are going to be comparable to surgeons in the United States in many cases. If you're going to go to one of those people, you could be in really great hands. But if the primary appeal of going abroad is that the price is dramatically lower than anything you found at home, that gap in price is telling you something. And in eyelid surgery specifically, that's a risk I would think very hard about. Let me tell you about a patient I saw that I still think about. She had gotten her eyelid surgery done in Mexico and came to me simply for suture removal. Routine, straightforward, or so I thought. So when she arrived, I had no records, no operative notes, no information at all about what her surgery had actually done. I was flying blind, which I really don't enjoy doing. When I examined her sutures, one of them looked like a standard skin stitch, the kind that you remove by simply cutting and pulling it out. So I cut it, and when I went to pull it out, it wouldn't pull out. I was anchored to something way deep under the skin. I pulled a little bit more carefully, and then I realized there was some sort of knot tied to the stitch inside the eyelid, but the stitch was coming out of the skin on purpose. A skin stitch does not get anchored to deep structures and then come out. I trimmed it as best as I could, but I had to tell her honestly, I don't know what your surgeon did here. I can't vouch for this technique, and I can't tell you with any confidence what is going on beneath the surface. That was an unsettling conversation for me to have. I can only imagine how it felt for her. That story is not about a catastrophic outcome. I've seen those too. It's just about something more insidious. It's about the moment when something unexpected happens and there is no continuity of care, no records, no surgeon available to answer for their own work. Here's the important thing. Eyelid complications don't often happen right away. They emerge over weeks and months. So if you're at home dealing with something unexpected and your surgeon is unreachable and MIA, a manageable complication, if you'd been at home, can quietly become a very serious one over time. So if you're thinking about going abroad, ask yourself whether the cost savings justify the risks of having a poor outcome with nobody to ask when you're back from Turkey. Tip number 4, understand what a realistic outcome actually looks like. This one is different from the others because it's not about avoiding a surgical mistake, it's about avoiding a mismatch between what surgery can deliver and what you might be expecting. And that mismatch, when it happens, can make a technically excellent surgery feel like a failure. Eyelid surgery is remarkable at what it does. Upper blepharoplasty takes a huge amount of heaviness off for patients that at times can be life-changing. It's like taking off a wide-brimmed hat that has been stuck on your head for years. Lower blepharoplasty can make you feel more energetic and less tired when you look in the mirror. Done well, these procedures are genuinely transformative, but here's what they shouldn't do, in my opinion. They shouldn't make you look like a different person. If that's what you're going for, just please think long and hard before jumping into any surgery. The goal of surgery, in my opinion, is to restore a more youthful version of yourself. And remember, surgery doesn't stop the aging process. The results are long-lasting, but they're not permanent. We're working against gravity here since we're on Earth. I have seen patients who have had objectively beautiful surgical outcomes, symmetrical, natural, exactly what the procedure was designed to achieve. But they were still dissatisfied because the surgery either didn't meet their expectations or they might have just been unrealistic from the get-go. Here's the solution. Have a brutally honest preoperative conversation about what you're hoping for and ask the surgeon if that is actually achievable. Bring photos of yourself at a younger age. Tell your surgeon specifically what bothers you. A good surgeon will tell you very directly what is and isn't within reach. If your surgeon just tells you that everything under the sun is possible and never manages your expectations downward at any point, circle back to reason number 2 because that's a red flag also. Okay, so here's our bonus tip, the one question that reveals everything. I promised you at the top, so here it is. Before you book surgery with any type of surgeon, ask them this one thing. What would you do differently if a patient had dry eye? That's it. That's the whole question. And here's why it works. And it doesn't matter if you have dry eye or not. Dry eye changes almost everything about how eyelid surgery should be approached. How much skin can safely be removed from the upper eyelid, how aggressively the lower eyelid can be addressed, what the recovery protocol looks like, what the risk profile is. A surgeon who truly specializes in eyelids will have detailed, specific answers to this question. They'll talk about what they can do to protect the cornea, which is the front layer of the eye, and the answer will come naturally because this is something that they think about every single day and they account for. A surgeon who doesn't specialize in this area will either give you a vague reassurance, yeah, we take that into account, or they'll pause in a way that tells you they just haven't thought about this very deeply. You'll know the difference when you hear it. You don't even need to have dry eye for this question to be useful. It's just a diagnostic tool. It tells you immediately whether the person across from you is thinking about your eyes as functional organs that need to be protected or just as some cosmetic problem to be solved. Ask that question. The answer will tell you almost everything you need to know. So let me bring this back to where we started. That patient who came to see me, the one who knew the night before that she was taking a risk, she did eventually do well. Her revision was complex, but her lower eyelids were restored and her upper eyelids were given back enough skin to close properly. She looks good now. But she went through months of discomfort and risk that she didn't have to go through. The 4 things that will protect you are not complicated. Find a surgeon who specializes specifically in eyelids. Pay close attention to how your consultation feels and know what the red flags look like. Think carefully about continuity of care if you are considering surgery abroad, and go in with a clear, honest understanding of what you're going to look like on the other side, and ask that question about dry eyes. Eyelid surgery done right is one of the best investments you can make if you're thinking about plastic surgery and you're interested in improving how you look and how you feel inside. The goal of this channel is to make sure that you have every tool you need to get there safely. And remember, always seek treatment from a qualified medical provider before undergoing any kind of treatments around the face. Thanks for watching. I'll see you in the next video.